Now let's start with the history of the maths, in which you have to ask about the questions. So the questions related to the cancer metastasis, so ask about the ascites, and ask about the lump in the axilla. Actually, the lump is the lymph nodes. So the patient doesn't know about the lymph nodes. So you may ask about the lump. Lump in the axilla around umbilicus, or lump in the neck. So these are the lymph nodes. Third would be jaundice. Does the patient had jaundice during this period of time? Difficulty in breathing, and pleuritic chest pain. Hemoptysis, and ask about the thrombophlebitis and edema in the legs, or pedal edema, you may say. Lower back pain, and menstrual history, so these are the questions regarding the meds. Okay, so continue with the risk factors. So let's discuss about the risk factors. The question you have to ask to the patient. First is about addiction. Like in Asian countries, patients are addicted to betel nuts, pan, cigarette, and hookah. And also ask about the alcohol addiction too. Ask about fatty food consumption. Fatty food, smoked food like smoked fish, chicken, and salty food consumption. Ask about the previous OGDs and previous any biopsy, previous GI surgeries, travel to the foreign countries. Okay, in the food, we discuss salt food consumption, also about the canned food consumption. It's very The consumption of the canned food is very prevalent in the Western countries. Ask about the anemia and repeated transfusion. This is for history of the pernicious anemia with chronic atrophic gastritis also. If the patient presented with the lump, then you may ask about the pets. Does the patient have any pets in the house? And raw vegetables consumptions also. Gastric carcinoma is very prevalent in patients who have blood group A. So ask about the blood group, specifically A. So these are the questions related to this. Then for completion of the history, the other parts like systemic inquiry, you have to do systemic inquiry. So it starts with the CNS, ask about the headache, fits, and recent onset headache, and altered level of consciousness, double vision. And for respiratory system, ask about the hemoptysis, cough, pleuritic chest pain, tachycardia, anemia for the CVS, and for abdomen, jaundice, ascites, annulum, altered bowel habits, for musculoskeletal bone pain, recent onset joint pain, radiculopathy. So these are the questions you have to ask in the systemic inquiry, and specifically the weight loss. Then go for the personal history. Ask about the sleep, appetite, micturition, bowel habits, addiction, weight loss, and past medical history like hypertension, diabetes, mellitus, and any previous family history of the carcinoma. It's very important. This is also a risk factors. Of CS. Which type of CS? Gastric, colon, and breast. So these are very important. The past surgical history with the patient and trauma history, transfusion history, allergy history. Is the patient is allergic to any food or any medication, and currently which type of medications patient is taking. So these questions are very important. Then family history and also the socioeconomic history. If the patient is female, then ask about the menstrual, or you may say gynecological history also. So these are the components of the history, and we have completed the history regarding gastric aortic obstruction. So stay tuned for the more videos, and also like the video and subscribe my channel. And if you want to add some other questions, so you may comment in the comment section. Thank you. Bye bye.